Good day to everyone. I am Dr. Nestor C. De Guzman. I'm a doctor in the field of education, and I am here in CSA for a consultation and eventually for a treatment. So this is my first time to be in this clinic, and I'm hoping that I will get the best curement for my skin. My concern is about my face because as a teacher, I always act or teach in front of the students, and at the same time, I am a speaker in the field of teaching. So sometimes I'm conscious about my face. So I decided to talk to my batchmate, Dr. Contessa, for a consultation, and having a good heart, she asked me to visit her clinic and set for an appointment, and this is today. Don't forget to subscribe and ring the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome Sir Nestor De Guzman. Welcome, sir, sa ating CSA. First time.
First time,
po,
yeah. After how many years?
I know, right? So, sir is working with the school, DepEd, yeah. Okay, and always busy, and mostly students are in what level?
Elementary and graduate school and college and college.
Oh, wow. So like, yeah.
A part-time job.
Part-time job, right? So parang yung, ano mo, from young to not so young to...
Yeah. PhD, the postgraduate.
There you go. So you cater all those ages. How was it?
So far, okay naman. There's no big adjustment because I was able to teach naman during the kinder level.
Yeah.
So all the levels in education.
Very versatile.
But right now, medyo may malaking adjustment because of the pandemic.
The pandemic, yeah.
Yes.
And you're trying to do online classes and adjusting really. Yeah. Yan. Kami po ni Sir Nestor, we're batchmates during high school. Yan. So, our age, same. Same kami ng age, yan, golden.
Ano na kami?
We are golden.
We are maintainers.
Maintainers, yan. May mga maintenance po kami. You're true. Correct. Correct dyan. Yan. Of course, at this time, 50s, okay?
Yes.
What do we expect? So, on our face.
Yes.
So, we're at the heart of assessment, okay? And when I do assessment, I subdivide the face into 3 parts, the upper, the middle, and the lower. So, the upper third, as usual, we always check for lines and creases on the forehead region in between the eyebrow area. We check also the eyebrow position and also the upper eyelid. Yan. Sir Nes, dati bukas na bukas yung mata.
Oo.
Ngayon, parang hooded. There you go. And we also check on the temple and the corner of the eye. As we age, there you go. There's sagginess, everything goes down, full of gravity, the loss of collagen and elastin and glycosaminoglycans in our skin tissues. And in the mid-face section, first thing we check also is the under eye area. So under eye, volume loss, sunken, lubog, parang laging puyat, or yun, overwork, over-fatigue. And you'll see in the mid-cheek section, there you go, some lines there, creases, grooves, lumulubog, yan. And also nasolabial fold here, deepening na. And when we check on the side of the cheeks, merong depression here. I told Sir Nes, magandang ilong. Yan. Even the nose will age as time passes by. It droops down. Okay. And lower third, we also check, syempre, the lip area. Some people will have thinning of the lips. Some people will have lines around the mouth, or yung tinatawag na barcode. Got patients with like several lines on the upper lip, and then also the downturning ng corner ng mouth, this one, and marionette line here, and jowls here, and the loss of definition. Dami nun, Sir Nes.
Oh.
Yan. So the angle here, yan, yung angle nito, nagiging blunt. So no more definition of the angle of the mandible or the jawline. And then as we go on the under chin, this part, yan, it bulges. The others are saying merong turkey neck. This part here, bulges or like laxity. Yon, lahat na. Okay, so with science right now, aesthetic medicine right now, there are treatments that we can do to reverse the signs of aging. And another thing that we look into also is the quality of our skin. So if you look at the envelope, the outer, the skin layer, so yan, kami ni Sir Nes, when we were in teenage years, high school, acne problem, right? Ako nag-start second year eh. I noticed some, yun, merong mga papules, may mga, ano na, yellowish red areas. Then, I didn't know if I was popping them eh. Ikaw ba, sir? Mahilig ka bang ng mga acne? Mahilig kang mag-squeeze, mag-manipulate, and then it worsened to a point that it became bigger, inflamed, ayun na. And then, of course, when we had acne, inflamed acne, they will have acne scars, leading to acne scarring. So, we'll notice some sunken acne scars there. Plus, over time, we'll see pigmentation. Yan, sun exposure, leading to some sunspots, yan, and melasma. Yun, nakaka-relate ka ba, Sir Nes?
Yes.
Relate na relate. Ako rin nakaka-relate. So, we want to target those concerns that we have right now. Correct? So, at the same time, also, we want to improve the skin quality of Sir Nes naman. We somehow wanted to reduce this acne marks, acne souvenirs. Yan. Kalimutan na natin ang nakaraan.
Yes.
Yan. Forget the past. Yan. So, what kind of treatment, what procedure we will show you when CSA Medical Aesthetics return. And we are back with Sir Nes here. Sir Nes, how are you feeling? Good. Okay, I do understand because treatments like this will be first time for Sir Nestor, okay? And the approach will be, again, non-surgical, and we want a rejuvenation and a treatment that will also give a result. That's what we want to achieve here, okay? So a while ago, we did an assessment already. For now, I'll be working on the mid-face to the lower face of Sir Nes. I wanted to also lift these saggy tissues here, and at the same time, stretch the skin to reduce those sunken scars, okay? So the treatment that I will do first will be the so-called PDO cog thread lifting. So these are made up of absorbable protein filaments, okay? And they will stimulate collagen formation and also restore the natural elasticity of the skin, and at the same time improve the quality of our skin. Okay, sir? Okay, yun. So, of course, with procedures that we do, we cleanse the area, we disinfect. We also applied numbing cream a while ago. We left it for about an hour. And then, I'll also be doing the so-called nerve block here. Nerve block is on the infraorbital area here. We wanted to numb the infraorbital nerve there so that this will be a procedure that will be very, very tolerable, okay? So, nerve block on the mentalis nerve here. And then, entry points will be on the side of the face, okay? So, I have a lateral canthal line here. I'll start this part here. Okay, so when we use our PDO cog threads, we follow certain like designs, vectors. So where do we want to direct our lifting? So usually the lifting will be directed upward posteriorly, okay? So this is just injecting for my entry point. Then I'll start with making my entry point puncture. So I follow the lateral canthal line there, okay? So just a tiny prick there. Okay, I have my sterile OS here. Okay, so I'll still make my so-called linear infiltration of my lidocaine there, just to make sure that everything is numb. Sir Nes, when we were in high school, how were we? High school days, you still remember?
Yes. Actually, di kita classmate eh.
We were not
Pero
that.
you are an idol because of your intelligence.
Oh my gosh.
Diba number one section ka?
Thank you so much for that. That's the result of prayer. Yan. Thanks to God. Yun. Of course.
Tapos
lahat ng
silent type ka
blessing.
lang.
Ayun po.
Yun.
Actually, mahihain ako nun, sir.
Parang manang na.
Shy type. Yan. You know, when we were young, teenage years. And during our time, it was so different then.
Yes.
Right? Our parents were so strict.
Kaya nga di ako nag-attend ng JS eh.
Exactly. So they don't want you staying late at night.
Yes.
My parents were strict, like you should be home by 6 p.m.
6 p.m.
Right now, it's different, sir.
Dapat 3 a.m.
They come home daw early naman daw, but it's really the morning na. So I'm directing my cog into the nasolabial fold there to lift this part here and then insert and then just glide it in the soft tissue layer. So usually we say that the safe plane to insert your PDO cog is in the, it's what we call layer 2 or the subcutaneous layer or your SMAS layer. So when we use our cog, we can place it in the suprasmas and in the SMAS layer. Okay? I am just injecting the lidocaine just to numb the area. Okay? Again, the goal here is to lift the saggy tissues, reposition them. Because originally, we have lifted tissues, they were tight, they were firm, our ligaments are really that strong, but as we age, everything weakens. So we just want to restore the strength of those tissues there, okay? So I'm placing it in the SMAS layer. I usually start in the sub-Q and then go to the SMAS layer as I cross this so-called vertical line from the lateral canthus and directing it towards that nasolabial line there. So it's expected to have some resistance because we have some fibrotic bands from the acne scars there. So we just glide it. Okay, and then I'll be using 5 cog threads here on this side here. So the one that I have right now is the so-called Stellar PDO Cobra cog threads. The length of my cannula is just 90 millimeter, but the thread is longer compared to the cannula there. So I'm already on my third. So I'm just gonna make my entry point again and direct it in here. So again, we just want to reposition the soft tissues and at the same time stretch the skin, because the acne scars, we also have 2 subtypes, the so-called stretchable one and the non-stretchable type of acne scars. So if you stretch the skin, you'll notice some of the sunken scars will be resurfaced. And we also want to stimulate collagen. So some of our sunken scars will also be improved by that collagen resynthesis. So mechanism of action of polydioxanone is the so-called mechanical lifting. So we're on the 4th. I'll just be using 5 of this. I'll be doing a so-called combination procedures for Cernès. I'll also apply my Eladerm for the acne scars as well as the melasma, and at the same time we'll infuse some skin boosters, and the final one will be the so-called Regeron S. Regeron S is a polynucleotide. S stands for scar, so the Regeron S is specific for those sunken atrophic acne scars. Okay, we're just on the 5th one right now. So if you have the Regeron S, we can start also injecting the Regeron S. I'll work first on this side here, on our right area. You're still good, Sir Ness. I'm done on my, this is the final cog thread. Then I'll just do my Regeron S. So I have my polynucleotide injectable. So we'll just cut off these remaining strands here. The remaining strands of my PDO Cobra Cog threads. And there you go. And then let's already incorporate the Regeron S. Then the final one will be the so-called Eladerm device. The Eladerm device is RF microneedling. So for those who have acne scars, that's a gold standard for acne scar treatment also. So this one is Regeron S. You just inject it directly into your sunken scars there. And the type of medicine that we're injecting, these are regenerative right now. So when you say regenerative, they also stimulate the synthesis of those connective tissue molecules or help the extracellular matrix proteins be restored. Okay, I'll be using half of this syringe here. So usually we do sessions of Regeron S. Like in a month, you can do 1 session in a month or 2 sessions in a month. So depending on the severity of the acne scar. So it will depend on how deep, how wide, or the size of the acne scars. That's how much we give. Okay, so we can already also apply our Eladerm here on this side. So I noticed on the temple also, Sir Ness has these atrophic scars. So we expect some pinpoint bleeds from our injections. So let's apply the Eladerm now, then we'll be working on the other side. You're still good, Sir Ness? Okay. So 5 cog threads together with the Reduran S and the Eladerm right now. So this is now the Eladerm radiofrequency microneedling with cryogen spray. So that spray has this cold temperature, so it will also help in alleviating any discomfort. You're good, Sir Ness? Yeah. So it has micro needles, micro pins that will reach your reticular dermis where you have fibroblast cells to stimulate new collagen formation, elastin, and extracellular matrix proteins. Then after this, they will also apply skin boosters that contain micronutrients like your amino acids, peptides, vitamins, minerals, some growth factors, and your regenerative repair components for the skin. So we'll also work on this part here. So we have some acne scars here, so we wanted to improve that. So treatment like this will require sessions. We cannot just one-time treatment only will already see the skin becoming even and smooth. So we need some sessions for this one. Okay. Well, acne scars didn't happen overnight. So it's a treatment that will require also maintenance. So maintenance, no, Sir Ness. Yeah. So we're working on this side, and I noticed some pigmentation. Usually it's caused by the sun exposure. So we have melanin pigments there, releasing your melanin, released by your melanocytes. Okay. So after this, we will proceed to the left side. Have completed the treatment for Sir Nestor. We'll show the result when we return. And we're back, Sir Ness. How are you feeling? So far, so good.
So far, so good.
Okay, let's show the result to Sir Ness. Ness, here's the mirror. You can just check.
Mirror on the wall.
We just did this non-surgical approach, the cog thread lifting mid-face to the lower face. We just used 5 pieces on this side, 5 pieces on the other side, and we combined with some Reduran Scar injectable, the polynucleotide. It's just 1 syringe, and we also did the Eladerm. Then there's also some skin booster infusion and Helite, and also soothing gel and soothing mask in a little while. So far, Sir Ness, how are you? Yeah, there's already. Yeah, actually that's the anesthesia initially, but actually you lack volume. You also need to restore volume in your tissues because when you have sunken parts, then it created that look of being older. Okay, so sunken areas we need to also restore volume. Actually, we had injected some of the Reduran S in the superficial layer to flatten the sunken scar. Yan. So that's a temporary thing. Yung akala mo increase yung size. Anesthesia, it's gonna, yes. But you notice there's already a lifting of the nasolabial fold. There's an instant pull of the nasolabial fold because we use cog threads. They grasp the saggy tissues, reposition them upwards. That's the goal of this cog thread lifting. This is a mechanical lifting. Plus, there will be mechanotransduction, which is the cellular response whereby they will produce or synthesize new collagen, elastin, glycosaminoglycans, and other extracellular matrix proteins there. It will revive, rejuvenate, revitalize your tissue structures, your skin structures, okay? So, yon. But so far, so good, right? Yeah.
Parang bumata ako ah.
Yes, yes. So, the goal here is to restore a younger look, okay, in a natural way, and we still want it to be very appropriate to our age. That's the thing with our non-surgical approach right now. We just want you to revitalize, rejuvenate naturally, okay, and appropriate lang at our age. It's not overdoing it. It's not too much of one part of the face, making it balanced and symmetrical and proportion. That is actually a key feature for facial attractiveness. Symmetry, proportions, balance, within the angles, ratios, and dimensions. Correct dimensions lang po. Plus good skin quality and skin color homogeneity, yung skin texture. So this is just a beginning. This is our first time with Sir Ness. So we have a journey, Sir Ness. We still do a follow-up for him. Okay. So any like a message to the audience about the experience and, you know, anything you wanna say to them?
Yeah, actually, this is the first time.
Right.
Ang tagal ko nang, kino-convince sarili ko. Pero yun nga, because of insecurities, ganon. But sabi ko, as a teacher, as a speaker,
Right.
in front of audience, sometimes nako-conscious ako sa sarili ko because of my face. And nagkaroon ako ng guts through the motivation of our doctor here. So sabi ko, and the result is good. Tapos
So
wala
far.
man akong
Yeah.
pain. Walang pain na naramdaman na in-expect ko baka tasakan ako ng ganito.
Yeah.
Hindi.
Right.
So far, good.
Thank you, Sir Nestor. Ayan. Actually, right now, what you're saying about beauty or your facial attractiveness is, it's not only like the outside features, you know. It's your personality plus having that confidence in yourself. Okay? So, yung mga outward looks, of course, they're part of it,
Yes.
but it's also important yung inside,
Yes.
yung beauty from inside, from
Meron na
within.
ako nun.
Yes, and
Meron
it
na
will
ako
radiate
nun.
outside.
Kaya yung outside yun.
Yan, correct. So, we're working on the outside. Thank you so much, Sir Ness, for trusting us.
Thank you also for
Okay. We'll
for
see you again
motivating me.
on your follow-up. Okay. So, if you have any questions, you may email us at csaskinclinic@yahoo.com. Our FB page, CSA Medical Aesthetics. Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Sir Ness, meron ka bang social media that they could follow you?
My Facebook account.
Yan.
Yun na lang. Sir Ness De Guzman.
De Guzman. There you go. Thank you so much. And please do watch our other videos. Just type Contessa Salvador and click the subscribe and notification bell. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.